was it like a colon problem or if it was like a urinary tract infection. And I thought because I thought I had a urinary tract infection. And I took amoxicillin and everything to wipe it out. But, I mean, it didn't seem like anything worked until I took the jalapeno.
You know, I will tell you that spicy foods affect both the bowel and the bladder. So people have a sensitive bladder. You got to be careful with the spicy food. Same with the bowel. And so I'm assuming you're saying that you had a kind of a colonic, a jalapeno colonic, or was it more of a? It can affect either place.
Either place. So I mean, it could have been a urinary tract infection. It could have just been like internal hemorrhoids or something. I don't know. But all I know is I ate that jalapeno and blew me out.
Now, is that going to put you off jalapenos forever, Marcus?
No.
Okay.
I feel like it's going to make him. I mean, it seemed to solve the problem.
Yeah, blew him out. Yeah. All right. Well, it affects both of them different ways. Okay. Somebody texted, ban large capacity bladders and assault penises. All right. Jalapeno colonic, by the way, on 2 hours to midnight tomorrow night. I'm looking forward to that. Alan, I smoke marijuana. Sometimes when I cough really hard or sneeze, my taint cramps up. It's not really a question there. Maybe they're wondering if that's normal, if they're okay, or maybe they were just maybe they're just bragging. I don't know. But is there any connection with that? If they're smoking marijuana and then they cough really hard, if they get that perineal cramp?
I have absolutely no idea.
Yeah,
I think the two are unrelated.
Alan, I'm not sure if our hospital system has a urologist. What are the steps to getting the scrotal pump?
The prosthesis?
Yeah.
Got to see a urologist. You have to see a surgeon that does that.
Get to a hospital with a urologist.
Correct.
Like the Cleveland Clinic.
That's correct.
What would be the number they would call?
1-800-CCF-CARE.
Easy to remember. Easier to write down. Hey, Paul.
Yes.
What's going on, Paul?
I have a question for the doctor.
Yes.
A few years back, I went into basic training. It was January up in Chicago. And I walked down the sidewalk, this in January, a lot of snow on the ground. Walked down this slippery sidewalk, 20, 30 guys in front of me. Walked through a tunnel, and then coming out of the tunnel, it's uprising. And I wiped out. I smacked my head, and I busted my dupa. If you damage your sacrum, can that affect the little guy down there?
Absolutely. Yeah, absolutely. I mean, you can get nerve injuries that can affect you with a really bad fall. So there's
that's
no
your
doubt.
tailbone. Is that what he's talking about?
Yeah, the sacrum's the tailbone.
Yeah.
So, the answer is yes. You can disrupt the nerve supply. You can disrupt the vascular supply. But trauma is a cause of erectile dysfunction.
So a urologist should be able to help diagnose the problem?
If it's a nerve problem, there are ways that we can reestablish erections without needing intact nerves. Injections are a great way to do that. You take a very small needle, inject a drug directly into the penis, and get a very good erection for 30 to 60 minutes.
Wow.
But boy, you're really earning it too with that injection.
It's a small needle. I mean, guys think it's the worst thing ever, but our patients that do it all the time they have no problem.
They get used to it.
Yeah, get very used to it.
All right, there you go, Paul.
All right, thanks.
All right, good luck. Hey, Jim, hello.
Alan, how's it hanging?
Long and loose, baby.
Hey, I've got a question for the doctor. About a month ago, I noticed a couple of times I had blood in my semen. Recently, I haven't, but I've got my one testicle is extra sensitive. You just barely touch it or do something to it, and it will shoot that pain up into your abdomen. But then when you try to recreate it, it doesn't happen. I've felt them both. I don't feel anything weird on them or anything. but I don't know.
It's interesting, people think that blood in the semen is coming from the testicles. The testicles actually produce only a minuscule amount of the fluid in the ejaculate, so most of the time the blood that you're seeing in semen is coming from the prostate. So I think the two are actually unrelated. You may have an infection of the testicle, and that's a fairly straightforward thing to take care of. You go on a 10 to 14 day run of antibiotics, and it usually goes away. So that's something that's treatable.
I did do a urinalysis, and it all come back clear. Everything was good there.
What is something that could create an infected testicle?
It's just one of those areas that has a tendency to get infection.
Really?
It's not that uncommon. It is in, continuity with the outside world because the vas deferens does connect to the urinary tract directly. But also, you can get hematogenous spread. It's just an area that has a tendency to get infected.
Hematogenous spread.
Through the bloodstream.
Yeah, okay, gotcha.
Yeah,
all
sorry.
right.
What was that?
It's a very common place to get an infection for whatever reason, and 80% of the time, our experience has been 80% of the time that we put people on antibiotics, the symptoms go away.
Okay.
All right. Good luck, Jim.
All right. Thank you.
Thank you. Text. Alan, I've had ED and PE for several years. What's PE?
Premature ejaculation.
Premature ejaculation. Okay. The drugs work well, make me feel like Superman. However, I don't want long-lasting side effects. Anything I can do naturally to treat other than better diet and more exercise? The lengths people will go to avoid better diet and exercise.
That's an interesting combination, though. Erectile dysfunction and premature ejaculation.
Yeah, right? Make up your mind.
One thing that's been used for premature ejaculation, so available over the counter, are just lidocaine creams or that kind of numb the tissue and make you go a little bit longer. So that's a way to have a
maybe jalapeno.
Ooh, that's going to be spicy for everybody.
There you go, yeah. ED and premature ejaculation. So it's like I have a hard time getting it up, but then when I do, I go really fast.
Yeah.
Wow.
And the drugs that help with PE can cause ED. So,
Get you coming and going.
Yeah, that's a problem.
Please ask Dr. Berglund, my hydrocele is causing pain. Is this a problem?
If it's causing if it's a subjective problem for you, it's causing pain, that's a problem.
That's a problem.
Most of the time we leave them alone. Most of the time they're not causing a big problem. And the solution is surgery, and surgery itself can cause problems. So how big a problem is it?
Hey, Jake.
Hey.
What's up?
I'm a construction worker. Lots of us are heavy drinkers. I got a problem where when I pee, two streams come out. I happen to have, apparently, I don't obviously know, I was an infant, just born, had a condition where they had to reroute my urethra so I could pee out the tip the right way. I don't know if it's because I'm a heavy drinker or if it's something that this surgery has maybe reverted back from. Is that something I should look into with a urologist?
You had what's called a hypospadias, and the hypospadias was repaired when you're really young, and that it was a great thing that they did it when you're young. You know why they do it when you're young, when you're very young? Is they want to treat it.
So I don't remember it.
Exactly.
No, it's for the priests.
Right. Yeah.
You're actually exactly right. You actually want to treat the patient before they have genital awareness. And so you never remember being treated. So you don't have any. The echo's a little.
Yeah, the phone there is.
I've only been told about it by my parents. But now I'm.
Gather around, son. We're going to tell you about your hypospadias.
Let me tell you a story about your penis, isn't it?
I would not be surprised if you have some type of recurrent obstruction or scar tissue from your prior hypospadias repair. And they probably did a great job on your hypospadias if it lasted this long and wasn't causing much of a problem. But that's a fixable problem. I mean, that's something where see a urologist who can scope the urethra and just make sure that there's no blockage there. I mean, there are other things that can cause the splitting of the stream. You could have just a big prostate. But with that history, there's certainly a possibility that you got a little scar tissue that could be opened up and it could reestablish a more normal flow.
I mean, I'm going to be full blunt honest. It's gotten so bad where I don't even bother. I can spread the tip of it all I want, and it still might come out in 2 streams. I just sit to pee now. I'm like, whatever. I guess I'm going in a stall in a public place. Whatever. But
it'd be interesting. I'd like to. I mean, that's one thing we'd need to take a look at, because sometimes you have 2 separate openings, and that's why you have 2 streams. You could even have a fistula that leads to a second stream.
Mm-hmm.
You know.
Okay, that's good information. Then I will probably be calling your office on Monday morning.
That sounds great.
All right, good luck, Jake.
Thanks, Doc.
All right. I was talking to somebody, we've been going to a lot of weddings recently, and I was talking to somebody at my sister's wedding at home in Chicago this past weekend. And I don't even know how the hell we got on the subject, but this woman is telling me about how she didn't circumcise her son because she didn't want to make that decision for him. She wanted to, given everything that's going, and I understood where her thought process was, but she was like, I'm going to let him make that decision for himself. And my thought was, I would want to do it when I couldn't remember it. Because there's no way I believe people who, all the anti-circumcision crowd and let's bring back our foreskins and all that kind of stuff. And those people will swear to a person that it's traumatic and they remember it. And I'm like, you do not remember it. I don't remember anything even remotely close to being an infant, right? And so I'm like, why wouldn't you do it? Why have him do it when he's a grown man, where you're probably terrified and way less likely to do it and are used to how you've grown up with it? It just seemed very strange for me to somebody to go, well, I figure I'll let him make that decision.
It's a much different procedure if you have it in the first 2 months after birth.
Yeah.
A neonatal circumcision is a procedure that's done without, it doesn't require anesthesia. It's pretty straightforward to do. It's a much smaller procedure. The older you get, the more problematic it is. If you now, like our previous caller who had a hypospadias, for instance, you wouldn't want to circumcise that patient initially because you might need to use that tissue for the reconstruction. But you really try to get to patients before they get to kind of that 3 or 4 year old time where they start to have a lot of genital awareness.
Yeah.
Because then they do remember it, and they do have kind of, I'm not going to call it PTSD, but they have bad memories of what happened to their penis when they were younger. So,
well, there's also that portion of the electorate, for lack of a better word, people who will say, well, it's just some archaic religious thing and it has no actual, but you have said that there are higher incidences of penile cancer in people who are not.
So so
there is an actual scientific underpinning for it.
There are arguments on both sides.
Yeah, right.
And I can understand why people make a decision not to do it. The two big ones have been the heterosexual transmission of HIV.
In uncircumcised people.
In uncircumcised men, right? It increases. So being uncircumcised does have a higher transmission rate.
Yeah.
The second one is penile cancer. But, penile cancer is very unusual in the United States. It's actually very common in the third world. I've asked this question before. There's one country in the world that has essentially no cases of penile cancer.
And it's what?
Israel.
Yeah. Okay, right.
Right. It's true.
Yeah.
If you are circumcised as a neonate, it is exceedingly unusual to get penile cancer, almost unheard of.
Yeah.
Now, interestingly, if you get circumcised later in life, you don't have that protection.
Right.
So you have to be circumcised, right within 2 months after.
I'm glad my parents did it. That's all I know.
Yeah.
Hey, Dave.
Hey, hi, doctor. Excuse me. Got a question for you. I'm in my late 50s. I have diabetes, ED, benign large prostate, and I've noticed that recently it seems like the volume of ejaculate has been dropping off, and the last couple times there's been either none or just a little drop. Is that something to be concerned about, or is it just something normal that happens with age and the other medical conditions I have?
It's a little bit of all of the above. The first question I would ask is, are you on any medications for your BPH?
Yeah, a huge list.
But are you on like Flomax or Tamsulosin or Uroxetrol or Alfuzacin? Any of the medications to help urinate? Those will cause an ejaculation. They will cause you to not.
Okay, no, I'm not on any of those.
So actually, it probably is more the latter, that having an enlarged prostate, being older, being diabetic, you're probably not making as much fluid. You're having more difficulty releasing it, maybe not as good nerve signal. So it's very common to have reduced ejaculate as we get older. But a simple fix would be if you're on a medication that we know causes that problem.
I am on a diuretic. Could that do anything with that?
Unlikely that's part of the problem.
And insulin and diabetes medications?
Actually, insulin and diabetes medication help, right? By controlling your blood sugars, you're less likely to get those problems.
Oh, okay. All right, well, thank you. I got a great sense of relief. I was worried something bad going on. Okay, thank you, doctor.
All right, good luck, Dave. All right, let me take one last call here. Michael, hello.
Hello.
What's up?
I got a question for Dr. Berglund.
Yep.
Hey, I'm mid-50s. I have edema and severe neuropathy, whereas I really can't feel my feet, my legs, and I feel like it's gone up to my midsection.
Mm-hmm.
And it's pretty much difficult to get an erection. Like I'll get like maybe a semi, but nothing to the extent it will help me in any way. And I was wondering if nerve damage because of the neuropathy and the edema would have something to do with that.
I think first and foremost, age and health play a huge role, and clearly you have some challenging medical problems. You also have the neuropathy, which certainly contributes, and the edema doesn't help. My guess is you have penoscrotal edema, so you have a lot of swelling in the penis and scrotum. Is that correct?
Yeah, it's like pretty much I'm like a turtle.
Yeah. So you have like a buried penis, basically.
Yes.
Yeah, so I mean, there's a lot going on there. It's not just nerve transmission, it's not just circulation, but it's also just the physical makeup of your genitalia.
Is there anything I could do about that?
One thing is whatever you can do to control the edema, that would help. Just like we were talking about with the last caller, controlling your blood sugars as best you can. Is this a diabetic related? Oh, so it's not a diabetic neuropathy.
Okay.
And then treating the underlying cause of the neuropathy, whether it's a stenosis or or some kind of medical condition that's leading to the neuropathy.
Well, so nobody could tell me how I got neuropathy. I was in ICU for a long time, and they wouldn't let me out of bed for like a month. And that's when I developed it. And I got a heart condition.
A lot going on
side
here.
of my heart is.
Yeah. If you want my honest opinion, your best shot is to go straight to the penile prosthesis. That's your best shot. With patients that have a lot of medical stuff going on, they usually have very complicated neurologic and circulatory problems. So really, the penile prosthesis is usually the best option for erections. For sexual function. That's the pumping device in the penis.
The pump.
Yeah.
Oh.
All right, listen. Thank you, Michael.
Don't worry,
Good
it's
luck.
Reebok. It's cool.
It's fine. Yes, Dr. Ryan Berglund, you've done it again. You've said it all. What's the number for people to call the Cleveland Clinic?
1-800-CCF-CARE.
CCF Care. Thank you for being here. Good to see you.
Thanks for having me on.
There you go.
Is it red? Does it itch? Does it hurt like a bitch? Is it red? Is it red? Is it red?
Bill, by any chance, are you in the mood to start the weekend?
Been dying to.
All right, the Bill Squire Friday Get Down. Around these parts, it's how we begin the weekend officially in honor of the late, great Murray Saul. Take it away, William.
It's Friday! You got to get down on Friday, whether your power's out, you got ED, PE, neuropathy issues. Doesn't matter because the weekend is here, so enjoy it even if the power's out. It's no power, no power, no power. It's Friday!
There it is. All right. Wow. It doesn't matter what you've got going on.
Yeah.
You got no power.
No boner.
Now you've got some power behind you.
And I probably just gave someone a boner.
Right?
Yeah.
All right. That's the Bill Squire Friday Get Down, brought to you by us. And we'll take a last break here. And then we'll come back, wrap up. Guardians lost that first game today in the doubleheader against the Twins. That was 4-2. Second game is tonight on MMS. That starts at 8:10, 7:30, 7:40 around there is when your pregame coverage will begin. So we'll break, and you want to get the last word in on anything, send me a text, 35192.
This is the Alan Cox Show. Everywhere on our free iHeartRadio app or whatever smart device you have. Just tell it to play the Alan Cox Show on iHeartRadio. Win your way to our 2024 iHeartRadio Music Festival, presented by Capital One.
Starring Big Sean, Camila Cabello, Doja Cat, Dua Lipa, Gwen Stefani, Halsey, Hozier, Keith Urban, New Kids on the Block, Paramore, Shabuzi, The Black Crowes, Thomas Rhett, Victoria Monet, and more.
September 20th and 21st.
T-Mobile Arena here in Las Vegas.
Streaming live only on Hulu.
Keep listening for your next chance to be there.
At our 2024 iHeartRadio Music Festival.
Presented by Capital One.
Audible is a proud partner of the 2024 iHeartRadio Music Festival. Explore the best selection of audiobooks, plus podcasts and originals, all in one easy app. Audible, there's more to imagine when you listen. Sign up for a free trial at audible.com.
Here's what's trending from the iHeart Sports Network, presented by DraftKings Fantasy Sports.
Team USA captured gold in the women's 4x100-meter relay at the Paris Olympics today, while the men, they were disqualified. Guardians suffered their sixth straight loss in Game 1 of their doubleheader in Minnesota this afternoon. Alex Cobb will debut on the mound in the nightcap there. And Guardians right-hander Carlos Carrasco, he's on the IL now for the second time this season. He was put on the shelf